Viewer contributions make local programming possible on WNIN. Become a member of WNIN with your contribution so we can continue to make this programming available. Visit WNIN.org and click on the donate button.
Many of us make New Year's resolutions as we begin the start of a new calendar year. Often they focus on physical health, but you don't want to forget about mental health resolutions as well. We'll discuss next on WNIN Newsmakers. Welcome to WNIN Newsmakers. I'm Noah Alatza, the Chief Communications Officer for the University of Evansville. Every January, many of us have set new goals, usually about food or exercise, with some in our community are working to help people and set those goals for mental health. To learn more about improving mental health, we have with us Emily Reedford from Easterseals. Emily, thank you so much for making time. We appreciate it.
Yeah, thanks for having me.
Absolutely. First and foremost, Easterseals we know does a lot in this community, right, as it pertains to health services. I'm just curious, how does the organization work to promote, in particular, mental health in the community?
Sure. So most people know us for our medical therapies, PT, OT, speech, and audiology. But recently, we've expanded our mental health services with our psychology program. And there we do psychological testing and mental health counseling.
Talk to me about additional programs that might be available for people that are looking for help in the mental health space.
Yeah, so there's a lot of different avenues you can take with getting help for your mental health. Some people do need testing to get that accurate diagnosis to enter formalized treatment. Some people need counseling, just to be able to talk with another professional and process some of those things out, some life skills coaching, goal setting, that kind of thing. Some people need to work out traumas that have happened to them, related to their past or a recent experience they've gone through. Some people really just need more information to learn things for themselves. Maybe they want to help somebody else, and there are a lot of trainings out there that are designed for people who are not mental health experts, but people who can help relay that information. So think people like teachers, bus drivers, law enforcement professionals, that kind of thing.
I'm curious, Emily, too, have you seen, and I don't know if you have any data on this, have we seen an increase in those seeking services for mental health in the community, even over the past 5-10 years, perhaps? We
have. I think anecdotally, if you ask any mental health professional in town, they will say, yes, the need for our services is increasing. However, the number of mental health professionals in our industry is not increasing with that need. This is a phenomenon that's happening across the country, but in the Midwest, we're really seeing these effects on a much larger level. So what that means is not as many people are entering the field of mental health, whether those be social workers, psychiatrists, psychologists. We are in a shortage with human resources in mental health, unfortunately.
Here we are in the middle of winter. It's cold, we had the snow, and it's looking like it's only going to get a little bit colder. When we talk about seasonal depression, I'm just curious if you could share, are there any warning signs people can look out for, in the thick of the winter, or perhaps I know it can also happen in the summertime as well. Didn't know if you could share some of those warning signs and then what suggestions that you may have for them.
Yeah, absolutely. So whenever we talk about seasonal depression or seasonal affective disorder, really, we're looking at things in ways of a pattern. So everybody can most people can get kind of the winter blues and things like that when it's cold and dark and you can't go outdoors and that kind of thing. But seasonal depression really is a clinical diagnosis with some depression that does not, it does lift with the season. So clinical depression in a general form will happen all throughout the year. Seasonal depression tends to stay with a season. Some people actually do get it in the summer or in the fall, but most people who experience that, it has to do with the amount of sunlight that you're exposed to during the day. So usually around daylight savings time, people with general seasonal depression will start to feel those symptoms. And it really feels like any other depression. You're just kind of slow, sluggish, don't want to go out, increased isolation. A lot of people will eat differently when they're depressed and have sleep disruptions. Either they're sleeping too much or sleeping too little. So watching those patterns for yourself is going to be incredibly important, and kind of tracking that even if you can in a real way. So when you go and have a conversation with your provider and your doctor, you can chart that and show them what's really happening and where you're seeing that, and that'll help with your treatment progression.
I'm curious too, Emily, how can people get involved in the services, and where can they find out information about Easterseals?
Yeah, specifically about Easterseals, please go to our website and visit that. It'll have a list of all of our programs that we offer and our mental health services as well. So we offer clinical services, like I mentioned, the psychological testing and mental health counseling, but we also offer some of the trainings that I mentioned for people who are not mental health professionals, who just want to learn and be able to help other people in their lives.
How do you continue to increase awareness about mental health in the community, and what would your message be to those that may find themselves struggling?
Yeah, how do we do that is we talk about it. So things like this, other areas and platforms where we can have a healthy discussion about mental health is going to be incredibly important. It really helps to lower that stigma and encourages people that if they are struggling, there are people out there that can help. And the truth of the matter is we all struggle at some point in our lives, and that's okay, but it's not okay to do that by yourself. Reach out to those. As just as important as it is for someone to reach out to someone when they need help, I think we as a community have to do better about reaching out to those who we think might need help and say, are you okay? Is there something you need? Are you aware of these resources? Because it can be really hard to do that for yourself. But there are a lot of resources out there, and people are ready, willing, and able to help. But we have to normalize that for people and let them know that it's okay to reach out for help.
Emily Reedford from Easterseals, thank you so much for making time. We appreciate it.
Yeah, thanks.
Next, we have Julie Hoon, Vice President of Marketing and Communications from Youth First, joining us to discuss the organization and how it works to improve mental health in area youth. Julie, thank you so much for making time. We appreciate it. First and foremost, for people at home who don't know, what is Youth First?
A gem in our community. Youth First has been in Evansville for over 25 years now. We celebrated our 25th anniversary last year. We were founded in 1998, and so we're a nonprofit, a quite large nonprofit. We have about 130 employees now, and the majority of those employees are mental health professionals. Our whole model is strengthening youth and families. We have an evidence-based approach where we're promoting mental health, we're preventing substance misuse, and ultimately maximizing school success. We want young people just achieving and thriving so that they grow into being thriving adults.
Is that the mission, Julie, or walk me through the mission of Youth First?
That's exactly the mission. Our vision is communities that are champions of mental health and supporting youth and families in that endeavor so that we all thrive. And so the mission, how we do that, is this three-tiered approach to mental health, which I'll go into. But in a nutshell, we're embedding mental health professionals right in school buildings. We have 126 school partners across a pretty large footprint. We now serve 14 counties across southern Indiana. So these mental health professionals are highly trained, licensed in social work. Most of them are social workers. And they are right in the school building, right down the hall. They're a resource for any student. We serve K through 12 schools, and we also have a partnership with Ivy Tech, so we have a mental health professional in a college setting now. And any child in that building, any teacher in that building can meet with that social worker and seek help, seek assistance, and have someone to talk to, have a resource right in the building for mental health.
And we know, right, mental health is so important, right? And it's been thrown into the public narrative in recent years, or gotten away from the stereotype of it, so to speak. But particularly I'm curious with the youth that your organization works with, Julie, do you see any additional concerns particularly related to youth that Youth First is working with? And if you could even share maybe in the past 5-10 years, what's kind of changed?
Sure, and I'll kind of break it down by age even, since we do serve such a wide range of kindergartners all the way through seniors in high school, early young adults. what we see with our school partners and why we're in these buildings, why schools have prioritized mental health being in the building, it certainly peaked during COVID. I mean, we have always been talking about mental health and supporting young people, but we didn't say mental health 25 years ago. Our founder is a medical doctor who was seeing young people struggling with life traumas, turning to unhealthy coping skills, drugs, alcohol, addictions, didn't have home lives they could depend on. They were often kicked out of school and sometimes already dealing with incarceration, areas like that. So he saw young people turning to unhealthy areas instead of healthy areas, and he wanted to fix that. He wanted to understand how to meet young people where they're at earlier, and he knew that being in the schools would be the answer to that. So now we embed these social workers right in the school building, and they can work with students in group settings. They can work with them one-on-one, or we even have what we call a universal approach to general messaging, positive messaging in the school, why it's important to be kind, why it's important to not vape. We do a lot of anti-vaping messaging in high schools. But getting down into those group levels or a one-on-one level with our little ones when it comes to mental health, it's really things like social skills, struggling with controlling emotions. What we hear from school partners and what our mental health professionals see in elementary schools is things like kindergartners that aren't ready for kindergarten. And when I say they're not ready, it might be as extreme as they can't control their emotions and stand in line, or they're not even potty trained yet. They've been maybe raised on iPads and devices more so than taught how to control anger and stand in a line. So you can see where they're not quite ready to learn things like ABCs and 1, 2, 3s. We've got to work with them on controlling emotions and social skills. Then you get into middle school, high school areas, and what our mental health professionals see, especially nowadays, a lot of anxiety, a lot of depression, a lot of isolation. It's kind of interesting to think that in a time where we are so connected with phones and digital, devices, the weight of that connection and always being on, it's hurting our young people. They're feeling overwhelmed with how to cope, what person am I supposed to be? I've got to be someone for my family. I've got to be someone at school. I have to be someone online in my social media feeds. So they have a lot of pressures on their shoulders now, and a lot of it really does have to do with that social media pull, that digital pull.
And I wanted to ask you about that, Julie. So it's fascinating, right, because we had the rise of technology, right, e-cigarettes. I'm curious, did any of the concerns that you're seeing in youth now, did any of that come as a surprise to you? Is it something that Youth First was preparing for, that you kind of saw on the horizon? Did it come as a shock?
Oh, that's a great question. I think I know that with the rise of technology and the social media, I think what's been surprising has been things like we put so many guardrails on our children in the real world. We're not letting them stand alone at stop signs anymore, school bus stops, all that kind of thing. But then with gaming, with devices, with social media, you see things like trafficking and dangers and strangers approaching children and connecting with children. We've unfortunately even seen things like suicidal ideation and suicides happen because of areas that kids have entered online, and maybe someone wasn't there to help them be ready for that. So that has been a little alarming, and our social workers are trained and ready for suicide prevention, anti-suicide messaging, and even equipping. We have seen an increased ask of us to educate teachers, parents on what to do when you have a young person expressing suicidal ideation. So those areas are new and emerging, but we want to be at the forefront. We have a lot of parents asking us, how can I help control social media and these devices and get them off screen time? Even things like our young people aren't sleeping the way they should be. Teenagers are sleeping with their phone right by their face. They're not getting a good, healthy night's sleep. And sleep does so much for the body, so much for our mental health. And then I do want to comment on, you said things that surprise us. This rise in vaping, these e-cigarettes, it's alarming. Young people, what we've seen here is that there's a perception that there's nothing wrong with it. It smells good, it tastes good, it's cool. I can wear it under my sweatshirt, or do it at school. Schools are having to not only put stands in against vaping and what's happening in a bathroom stall maybe, but the substances in the vapes are sometimes illegal. And, those are just areas that I think are quite shocking right now with our young people.
I'm curious too, Julie, are there any misperceptions about youth that are struggling with mental health, just in the general community that you hear about?
I love that question because I do want to advocate for our youth and say that what might appear as a disengaged child, an angry child, an unmotivated child could really be some trauma going on, some mental health issues that need addressing, and as simple as needing connections. We firmly believe that the thought of one caring person in a young adult, one caring adult in a young person's life can change the entire trajectory for that young person. And so I think right now, stereotypically, you might think that young person, teenagers, they don't care, they're not motivated, or they're lazy, they're no help to us, but they really might just need some guidance or some love or some support, someone to talk to, and they want to be heard, they want to be listened to. They might have different views than we do, that our parents do, but they still want to be listened to and supported.
Julie Hoon, the Vice President of Marketing and Communications for Youth First, thank you so much for making time. We appreciate it.
Grateful to be here. Thank you.
Next, many have made New Year's resolutions based on getting into better physical health. Improving your physical health can also impact your mental health. And to learn more about these connections, we have Denise Perrinen from the YMCA of Southwestern Indiana. Denise, thank you so much for making time.
Noah.
We appreciate it. First and foremost, wanted to talk to you about the connection between mental health and physical health, and then some of the things that you're doing at the YMCA that work to improve not only people's physical health, but also their mental health.
Awesome. It's funny when people say what we're doing and when the members do the work, right? The members are the ones that lift the weights and plan their day and plan their workout. But I'm so excited and so privileged and honored to be part of an association like the YMCA. Noah, we're not a gym. We're not a gym. Now, we've got gyms. Let me tell you, most of our branches have gyms. And that's part, if you were to ask anybody probably off the street, what do you do with the Y? You work out in the gym. And that is true, but that's not who we are. We're so much a part of the community. It's in our mission statement that we want to reach out to the community to make it better. Anywhere from our outreach programs, but of course today we're here to talk about fitness and how that impacts mental health. And as you probably know, our human bodies create endorphins, and those are hormones. And those hormones are specifically to help boost your mood, pain relief, to help you deal with stress a little bit better. Now, working out is not going to create those hormones. Those hormones are there. But what exercise does is it boosts those hormones. So if you're someone, it's January in southern Indiana, and I love Evansville, and I love this area. January's tough, February's tough, with the cold and the gray a little bit, but I can get through it a little bit better knowing that I have the why. What does it do? It helps me so we're social creatures, right? And there's a social environment, and within that social environment, there are 3 categories. And this is just sort of what folks talk about when they're talking about community and that sort of thing, and how can we make Evansville better. One is, of course, your home life. That sort of has parameters, right? You've got bills to pay, you've got to take care of the yard, you've got to take care of dinner, your home life. The second category, or another category, is your work life. And that can be, once you're retired, it can be your volunteer life. And are the parameters there too? Yeah, of course there are. You either answer to somebody, maybe you manage people, you're managed by people, you have deadlines, you have everything. But the next category is the one that I think is so amazing. It's called the third place, your third place. So in the third place, you don't really have those parameters. You have options. if you go to your third place and feel like it's not working for me, you can choose to opt out of that. It might be your church. Maybe that's your third place. Maybe people's third place may be a bar to, post-work drinks or post-work just gathering. Maybe it is your canasta club. Maybe it's the golf course. So it can be that place that's almost playful. This community is so fortunate because we have our third place. One of my third places, and it's a pretty big one, is the YMCA. I receive so much from the YMCA because it isn't just a gym.
And you can have more than one third place, correct, Denise?
Absolutely.
It's fascinating too. You explain, we're social creatures by habit, but I'm also curious, you talk about the endorphins, the hormones, right, that are released when you're completing physical activity. How important is the physical activity component to individuals' mental health? Can you just speak on how important that is?
So we've also heard of the runner's high. If you know some runners, they'll tell you they get this endorphin rush, and it can happen in any sort of exercise program. It's probably more prominent in cardio workouts, but that endorphin rush, that release of hormone that really does help reduce stress, relieve a little bit of pain, and just help your mood. Again, in January, if you suffer with seasonal affective disorder anyway, a little bit, it's gloomy, but it's not just gloomy out there, it's gloomy in your head too. You feel like you have a fog and you just can't break through that. But with endorphins, you can. So if you get a good workout in, and whether it be at the Y or at your home or you're walking, whatever that is, suddenly, and I've experienced this many, many times, and I'm not a runner, but it's that cloud lifts. I'll be driving home from the Y, and it's almost as if the sun is shining where it wasn't before. I'm able to think more clearly. I'm able to really start strategically thinking again, where when you are down in the dumps, when you are just so covered up with just negative feelings or just helpless feelings of helplessness, that endorphin rush can help so much. It's not just physical, though, at the Y, what you can get from the Y. It's also social. It's that place where, again, it's optional. If you feel like whatever you're doing to work out isn't working for you, you can make some changes. If you go to the Y and try a class, if you try a body pump class that's lifting weights, all body parts, and you realize this is okay, but it's not really working for me. And then you go to a spinning class, and all of a sudden you have found your third place. So not only is the Y the third place, but then that spinning class becomes your third place too. We have two in the downtown ASVY. We have two spinning classes that happen at 5 o'clock in the morning. 5 o'clock in the morning.
Wow, that's early.
Yesterday they were standing out in 6-degree weather waiting to get in. But their third place is in that spinning class. And one guy goes to Barbados every January, and he's a regular. He comes all the time, doesn't miss a class. And so the class is telling him, you've got to send us pictures. We want to experience it with you, and he does. And so that is also his sense of place too, that he's able to give back some there.
And that sense of community too that you can build. Denise, I'm curious, you mentioned some of the programming. Are there additional elements of those programs at the Y that some people might be surprised about that you include?
This YMCA does, thanks to the leadership, does so many different varied programs. The depth of what we do is really amazing. Because of specialized programs, because of the training, a lot of training goes into every one of those staff people. And it's a training not just of skills and of life-saving abilities, be it CPR or whatever, but also how to listen to people, how to really shut up and listen, because that's important to give to those members so that you do know. We have a community health actual department. And what that department does, they have 2 programs right now currently running. One is Rock Steady. And have you heard of Rock Steady?
What is it?
It is a program for Parkinson's disease patients. And it is really full. These people, the trainers have been trained in Parkinson's. So in Parkinson's, and I'm not a neuroscientist at all, but from what I understand, the synapses in the brain don't connect. What helps that, and this is research driven, is repetitive motion. So Rock Steady is a boxing program. So we have amazing sponsors, and so that repetitive motion of hitting that bag. We also do a cycling program for Parkinson's. That repetitive motion at the same speed over a period of time really helps them with their symptoms. Doesn't get rid of them, but it helps a lot. Even during 2020 when COVID was big, we were having spouses and family members calling, begging to open up that Parkinson's program again. And we actually did. We did outside. And with, the necessary common space. But it's amazing. The other program that we do is Live Strong at the Y, and that's a cancer survivor program, and that's very dear to my heart. I wanted to tell you a short story. Yesterday I interviewed a lady, and I knew that she was in her 80s. And so it's like a blind date. So we're meeting each other in the lobby of the Y. And she comes up and she says, "Are you Denise?" And I turn around, and I really hope my face was pretty straight, because I was shocked. Here was this 85-year-old woman standing in front of me, and we could only hope to be as upright and feisty and full of life at 50. And she was really amazing. And the reason she does have a cancer diagnosis, but she's in remission and things are going really well for her, but she lost her husband in October. And she really needs that social. She said, so I want to get to the point, this woman knew what she wanted with it. Oh, she was so amazing. She said, I don't want to get to the point where my children have to take care of me. That's my responsibility. And I have the opportunity with the Live Strong program to be fit and to work on areas where I might not be as strong. But the other thing is, it is so easy that once your spouse dies or once you find yourself living alone, that you can just stay that way. And she said, I've made my commitment, I don't want to. And that's why I so much want to be in this program, because I want the social. She said, I'm hoping that this is an area I can give back, where maybe some experience I've had in my 85 years, I can give back to somebody else.
How can people then get in touch with what's going on at the Y on a day-to-day basis, every week, monthly, social media? Where can they go?
The best thing to do is walk through the doors. Our front desk staff, our membership staff are so great. Just walk in and say, I know nothing. I want to know what you do. And somebody will be there to help you. If you're at home, of course, YMCA, SWIN, southwestindiana.org.
And we appreciate everything that you do, Denise, and the rest of the team at the YMCA.
Oh, well, I'm the most privileged person, luckiest person in the world
Denise,
to have it as my career.
Yeah, Denise Perrin, the program coordinator for the YMCA of Southwestern Indiana. Thank you for making time.
Thank you, Noah.
Thanks to our guest for joining us to discuss the latest on mental health in the tri-state. I'm Noah Alatza. Thanks for watching WNIN Newsmakers.